Hello and welcome. I'm Eugenie Kayak. I'm Enterprise Professor in Sustainable Healthcare at the University of Melbourne and also Deputy Director of the Climate Catch Lab in the Faculty of Medicine, Dentistry and Health Sciences, and also a practicing anaesthetist in the Australian health systems public and private health sector. It's an absolute delight today to be in conversation with Nanny Santana. And before I begin talking to Nanny, though, I'd just like to acknowledge the traditional owners of the lands that we're on today. For us here, it's the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past and present. I'd also like to acknowledge their true stewardship of land, of country for millennia, their absolute connection to country and appreciation of the connection between healthy country, healthy people and healthy environments. We as a modern society have so much to learn from our First Nations people. So welcome Nanny, it's so wonderful to have you here at the University of Melbourne. Nanny is from the Brazilian Ministry of Health, where you're the advisor for international affairs in the Department of Environmental Health Surveillance and Workers' Health. She was also one of the architects of the Belém Health Action Plan. And I know you've come to Australia immediately actually from COP30 in Brazil. So thank you very much for your travels and for all the work that you've been putting in over the last few months. I can just only begin to imagine how exhausted you are. But it's absolutely wonderful to have you here, and particularly in Brazil, the Ministry of Health launched the Belém Health Action Plan, an international framework for the adaptation of the healthcare sector to climate change. So absolutely important in the 21st century as we really begin to grapple with climate change impacts on health, adverse impacts on health, and how that also impacts the healthcare sector. A sector that needs to look at both mitigation and adaptation. If the healthcare sector was a nation, it would be the 5th largest national emitter of greenhouse gas emissions. So whilst we look at that and address our mitigation efforts, it's really important that we're also looking at adaptation and learning or working out how we are going to manage the unavoidable. So wonderful to have you in Australia. I know you were here in Canberra earlier in the week at a very important COP31 roundtable held by the World Health Organization, and also where the Australian government very, very pleasingly endorsed the Belém Health Action Plan. And so having you here, I think, is a fabulous opportunity for us to gain invaluable insights from your work with the Belém Health Action Framework, how it was designed, and also to help us work and inform our Minister Bowen, who's now going to move into presidency of the COP31, and how we can really foreground and highlight Indigenous First Nation voices and also the voices from small island developing states moving forward, particularly in Australia's context, our Pacific nation friends. So thank you for being here today and in conversation with us.
Thank you for having me.
For those who haven't been across the Belém Health Action Plan, maybe we'll start at the beginning. And it would be great if you could actually talk a little bit about the launch of the plan in Belém and some of the key components of it.
First of all, thank you for having me. It's an honor to be here today. I wanted to provide some context. The Belém Health Action Plan comes out as a collective effort. So I would like to highlight my boss, Dr. Agnes, the director of our department, and Secretary Mariangela, because their vision very much informed how the plan came out to be. And it was an honor to be part of this drafting team that really focused on the fact that nations everywhere are facing the brunt of climate change impacts right now, and coupled with mitigation efforts, particularly for health co-benefits, we also need to have a strategy on how to adapt. So that's where the Belém Health Action Plan came. Considering that for the past few COPs, particularly COP26, which released the health program at the UK, and COP27 with ICANN, COP28 with the declaration on the impacts of climate change into the health sector and the guiding principles for financing climate and health initiatives, COP29 with the Human Development Day, COP30 comes particularly for the health sector on to building into these past initiatives. Earlier this year, we saw that the World Health Assembly adopted the Global Action Plan, the WHO one, which also informed the approach that we have been taking this year with the Belém Health Action Plan. It's just that the thing that makes the plan different and complementary is in its nature is that we should be also considering how countries can adapt and how we can do it in a way that really is not only considering multi-stakeholder engagement, but that speaks to different sectors and populations. So it's a plan that is meant to be flexible when in the implementation part of it, because we know that Brazil has different circumstances and it's facing specific climate impacts that is different from countries in the Pacific, that is different from Australia. So when we are talking about adaptation for the health sector, each health system will be facing its own challenges associated with climate change. And the plan, it's meant to be in its nature a policy piece that will help governments and their health sectors to adapt in a way that makes sense to their own local contexts. So speaking a little bit about how we developed the plan, Brazil has been hosting meetings to discuss this plan and consultations with civil society, with different countries, with the international organizations and academia since March of 2025. So throughout the year, we hosted a preliminary consultation. Later, we had the global conference on climate and health that we organized in partnership with the WHO, which served as a climate and health pre-COP. And the wonderful thing about it was not only were we able to discuss the content of the plan with all of the stakeholders, so we had representatives from civil society, organized civil society, from indigenous communities, from traditional communities of Brazil, but also from different parts of the world, so that when we were developing the text, it really reflected the principles of health equity, of social participation, and the concept of climate justice. And talking a bit more about the structure, the plans have 3 lines of action. The first being surveillance and monitoring, the second being evidence-based policies, strategies, and capacity building, and the third being innovation, production, and digital health. So we have priority measures proposed under each line of the plan, but at the same time, as cross-cutting principles, we had health equity and the concept of climate justice and social participation into climate and health governance, because we know that the policy-making aspect needs to be integrated with the voices and the necessities of the people on the ground that are facing the brunt of climate change. Particularly when we're talking about adaptation, we know that in the case of Brazil, the indigenous peoples have already developed so many strategies on the ground in the Amazon to face the climate impacts. So when we're talking about policy making from a government scale, we need to make sure that it reflects what the work that has already been done, and at the same time provides a platform for these people to have a voice and a say into the policy making aspect. So these are the core tenets of the plan. And since we've had so many consultation moments throughout the year, what came out in Health Day was a plan that reflected all of this diversity in a COP that was being hosted in the Amazon, as our president liked to call it, the COP of Truth, the COP of Action, and the Belém Health Action Plan, acknowledging that we have the declarations, we have the technical background, really. There's so much research into the climate change impacts into the health, human health. So now, what are the measures that we need to implement to make sure that we adapt in a way that, as we're facing floods, for instance, Brazil had floods in the southern part that were quite severe, that impacted health facilities, that made it more difficult for people to have access to healthcare services. So how can we adapt in a way that when we are facing the future impacts of climate change, our health services can continue uninterrupted and at the same time can also cater to the needs of the populations that are in remote territories that are most vulnerable to these effects because climate change does not impact everyone in the same way. So to sum up, it was in this context that the Belém Health Action Plan came about.
Well, what can I say? Congratulations, really, on such a comprehensive plan, but also a plan that really went out of its way with your consultation to be participatory, include those marginalised and most vulnerable people and communities, and also really understanding the flexibility that's needed when it comes to adaptation of the healthcare sector. I wonder if there's anything more that you would like to add, or that we in Australia, leading forward, could gain insights when it comes to actually engaging our vulnerable and marginalised communities to be embedded in the design of the plan and also then the implementation of the plan going forward.
Thank you for this question. I would say that for us throughout this year during the COP30 presidency, one of the major themes, as I spoke, was climate justice and also having in our sector health equity being a core principle. And that meant that throughout the plan, you have several priority measures that consider, for instance, when we're talking about innovation, production, and digital health. We know that innovation won't be effective unless it really is widespread and considers the needs of populations in situations of vulnerability. Because when we're talking about new technology for the health sector, for instance, it also needs to consider that when we are facing the impacts of climate change, several times services are interrupted. We need to think about the fact that when we are having droughts, that means that for populations that are in remote locations, they might not be able to get to the primary healthcare units. So how can we innovate in a way that it will be equitable so that we're not longer bringing new technology for the health sector, but we're also considering about, for instance, essential health products, medication that populations in situations of vulnerability might not have access when they're facing floods, droughts, wildfires, and how we can make sure that this new health product will also be, for instance, heat stable because they're going to be facing higher temperatures, or how these products might be single dosage so that populations who are in remote locations won't have to face the challenges of going multiple times to their health facilities to get access when it might be made more difficult by extreme weather events. So when we are talking about the implementation of the plan, now that Australia has endorsed, it means that for the climate changing health strategies that will be developed, and I know that Australia has already endorsed one recently from a national standpoint.
Yes, we have now a strategy, a national health and climate strategy.
Exactly.
Yep.
So when that is being implemented, the strategy, we need to make sure that for Indigenous peoples, for First Nations populations, that those strategies will make sure that healthcare services will be accessible, available, and equitable. That also meant that from the Brazil standpoint, our Minister Padilha, for instance, during COP, launched this new, we call it fluvial healthcare units, because we have now these solar-powered units that will provide healthcare services to the populations. We call it ribeirinhos. I'm having a hard time translating into English, but populations that live by the river, because sometimes it might be very difficult to come into the city. And now we have the fluvial units that are solar-powered, which means this is an equitable translation of policy proposed on the plan.
Yep, and more accessible to those remote communities.
Exactly. So that is one example, but there are several others considering the specific needs and contexts of Australia and the different countries that are endorsing it. But really, it's about thinking of health strategies that are effective, that they are concrete, and that they consider how we can make adaptation in a way that will be accessible and equitable. So that is something that for COP31, it should be on the minds of everyone involved.
And as you're also sort of highlighting there, that the synergies between adaptation and mitigation as well, so that when it comes to energy power and some of the other co-benefits of mitigation efforts. And yes, COP31, so Australia has been announced recently that it will hold the presidency for COP31. And so I guess as we look forward, to that and to some of the planning around that. Have you got sort of any particular advice or ways that you think that Australia could foreground some of the Pacific voices and the threats to the Pacific population's health when it comes to climate change and how that should be highlighted in COP31?
So, understanding that Australia will be the COP31 negotiations presidency, that means that there's a lot of space throughout this year to make sure that we take consideration of the needs of the Pacific people, but not also that, making sure that they have a space on the table. So for lessons learned considering COP30 was that was really the COP of social participation. We had several protests. We had Indigenous peoples meeting with the COP30 presidency. It was the largest Indigenous peoples delegation in a COP. So from several points, it's not just about listening, but making sure that when we're having decision-making moments, that these people will have a seat at the table. I think from the Belém Health Action Plan, that's what we mean when we're talking about climate and health governance with social participation. And I wanted to highlight a few outcomes of what we had in COP30, because making sure that people were listening also allowed for 10 new land recognition in Brazil from indigenous territories. Due to the disputes that were happening since Indigenous peoples had the place to sit with the presidency, one of the positive outcomes were making sure that 10 new territories were recognized as belonging to the Indigenous peoples. And that means concretely that they are there protecting the forest, the territory that has always belonged to them. So that was one national outcome, but at an international perspective, it also means that when we're having COPs, negotiations are very important, but also it's about making sure that we have actionable outcomes, that they can directly make a difference in people's lives. Right now, climate change is happening as we negotiate the different aspects of it when it comes to just transitions, the gender program. We should also be making sure that the population on the ground will be able to participate in the outcomes, and that they can have co-benefits directly from having the COP happening there. So I know from the decision that came out, a Pacific region will host the pre-COP, and that I would say it's a great moment to make sure that all the main priorities and needs will be highlighted during the pre-COP, because the world is listening. From our point, we hosted the global conference in July, and it was a moment where we were able to have representatives from the COP30 presidency, representatives from the Minister of Environment. So it wasn't just the health community being siloed, but it was a point of integration. So it's one example on how we can benefit from the fact that perhaps for this new presidency and for the others to come, it's not just about hosting the COP, but having the pre-COP moments already built into the agenda and feed into the outcomes. So I think for the fact that we'll have a pre-COP in the Pacific, this provides a great platform to make sure that the priorities when it comes to climate change and health can also feed into the COP31.
Excellent. Well, you've given us a lot of good advice and insights and things to think about going forward into COP31. Before we finish off, I guess, is there anything more that you would like to add about Australia carrying the Belém Health Action Plan into COP31 and how to sort of move forward with that action plan?
I would say the fact that Australia has endorsed the plan is very meaningful to us, because it also means continuity as we have the discussions about COP30 to COP31. Brazil will host the presidency this year. It's formally ceded to the countries on November of 2026. And Australia, being an endorsement, has a great opportunity to make sure that, for instance, if climate resilience for the Pacific region is one of the priorities, then that means adaptation. Now that Australia has its own national strategy for climate change and health, how can adaptation be concretely integrated into these strategies? What could be the priorities? For instance, one line of the plan that talks about health surveillance and the integration of climate change data into the health early warning systems. This is one of the ways that when thinking about concrete strategies, you can look at the plan and you can see that it has concrete proposed measures that can be implemented to make sure that when COP31 happens, we have concrete results. And that means that here in Australia, given that the plan is, it works from a multi-stakeholder perspective, where governments, universities, private sector, philanthropies, they all have a place in implementing the plan. It means that mapping out the initiatives that are already happening on the ground, developing new programs for adaptation that are in alignment with the Belém Health Action Plan, can also turn into concrete results that can be shown at COP31, following all the work that was built in COP30. I think, and I mentioned it previously, COP30 being the COP of truth and the COP of action, really gave attention to the fact that we, as we negotiate, as we continue to tackle climate change, we also need to be showing results right now. So we need to be implementing measures because we are already facing the brunt of climate change. So this year and the endorsement of the Belém Health Action Plan provides a good opportunity for the health sector and the environmental and the climate sector to meet us as we are at, and to build strategies and provide results that shows that we're not standing still in the face of climate change, that we are charging with action.
Absolutely. And there are a lot of synergies I see with the Belém Health Action Plan and Australia's own National Health and Climate Strategy, which has 4 objectives. The first objective is actually around resilience of the healthcare sector, and the second around sustainability of the healthcare sector. And integrated in it all is actually the perspectives of our First Nation peoples. So I can see that there'll be a lot of synergies and they'll work together well going forward over the next 12 to 24 months. So thank you, Nanny. Thank you very much for your time today. It's been an absolute pleasure talking to you, and we at the University of Melbourne really appreciate the time that you've given to us.
Thank you so much. Thank you for having me.